Welcome to This Week in Medicine, your filtered medical journal summary. Looking to stay up to date with the latest medical research but short on time? This Week in Medicine has you covered. Our AI-generated podcast provides you with a convenient, on-the-go solution to keep you informed about the most significant developments in the medicine field. Each episode offers a filtered and concentrated summary of key journal articles, allowing you to stay informed without the need to sift through pages of research papers. With This Week in Medicine, listening is faster than reading, and you can consume valuable medical knowledge while commuting, exercising, or during your daily routine.
Hi, This Week in Medicine, we will be discussing. First, we will be discussing articles in New England Journal of Medicine. Weekly fixed-dose insulin Efsitora in type 2 diabetes without previous insulin therapy. Background. In previous treat-to-target trials, adjustments to the dose of basal insulin have been made at least weekly, according to fasting blood glucose levels. A fixed-dose regimen of insulin Efsitora alpha, Efsitora, a once-weekly basal insulin, may provide a benefit in adults with type 2 diabetes who have not received previous insulin therapy to conclusions. In adults with type 2 diabetes who had not previously received insulin, once-weekly Efsitora, administered in a fixed-dose regimen, was non-inferior to once-daily glargine in reducing glycated hemoglobin levels. Next article. Trastuzumab Deruxtecan or Ramucirumab plus Paclitaxel in gastric cancer. Background. On the basis of Phase 2 studies, Trastuzumab Deruxtecan was approved for patients with human epidermal growth factor receptor 2, HER2-positive metastatic gastric cancer, or gastroesophageal junction adenocarcinoma, who had previously received trastuzumab-based therapy. Ramucirumab plus Paclitaxel is also a standard second-line treatment option regardless of HER2 status conclusions. Trastuzumab Deruxtecan led to significantly longer overall survival than Ramucirumab plus Paclitaxel among patients with HER2-positive metastatic gastric cancer or gastroesophageal junction adenocarcinoma. Adverse events were common in both groups. Events of interstitial lung disease or pneumonitis with Trastuzumab Deruxtecan, a known risk, were mainly low-grade. Next article. Tarlatamab in small cell lung cancer after platinum-based chemotherapy. Background. Tarlatamab, a bispecific delta-like ligand 3-directed T-cell engager immunotherapy, received accelerated approval for the treatment of patients with previously treated small cell lung cancer. Whether tarlatamab is more effective than chemotherapy in the treatment of patients whose small cell lung cancer has progressed during or after initial platinum-based chemotherapy is not known. Conclusions. Treatment with tarlatamab led to longer overall survival than chemotherapy among patients with small cell lung cancer, whose disease had progressed during or after platinum-based chemotherapy. Next article. Ivermectin to control malaria, a cluster-randomized trial. Background. Malaria control and elimination is threatened by the spread of insecticide resistance and behavioral adaptation of vectors. Whether mass administration of Ivermectin, a broad-spectrum antiparasitic drug that also kills mosquitoes feeding on treated persons, can reduce malaria transmission is unclear. Conclusions. Among children 5 to 15 years of age who were living in an area with high coverage and use of bed nets, Ivermectin, administered once a month for 3 consecutive months, resulted in a 26% lower incidence of malaria infection than albendazole. No safety concerns were identified. Next, we will be discussing articles from Journal of American Medical Association. Telehealth and online cognitive behavioral therapy for chronic pain. Question. How effective are remote, scalable cognitive behavioral therapy skills training programs for chronic pain, CBT-CP, for individuals with high-impact chronic pain? Findings. In this randomized clinical trial that included 2,331 participants, both the telephonic/video health coach-led and the online self-completed CBT-CP programs resulted in a significantly greater proportion of participants achieving at least 30% improvement from baseline in pain severity at 3 months, compared with usual care. Intervention benefits were sustained at 12 months, and the 3-month outcome was better for those in the health coach group versus the online self-completed program, meaning these remote, scalable CBT-CP programs are effective for treating individuals with high-impact chronic pain. Next, we will be discussing articles from Annals of Internal Medicine Glucagon-Like peptide-1 receptor, Agonists and Incidence of Dementia among older adults with type 2 diabetes. Background. Glucagon-like peptide-1 receptor agonists, GLP-1 RAS, have been shown to decrease blood glucose levels, promote weight loss, and prevent cardiovascular events. However, evidence is limited regarding their effect on dementia, although emerging observational studies, some with serious methodological limitations, have suggested large reductions in dementia associated with GLP-1 RAS that may not be entirely causally related. Conclusion. Among older adults with diabetes, no clear evidence was found that the incidence of dementia differed overall between patients using GLP-1 RAS versus DPP-4 is, under conventional statistical criteria, an effect of GLP-1 RAS between a 39% decrease and a 5% increase in risk for dementia was highly compatible with the data, although estimates differed by age. Randomized trials are needed to quantify the effect of GLP-1 RAS on dementia. Next, we will be discussing articles from British Medical Journal. Global, regional, and national characteristics of the main causes of increased disease burden due to the COVID-19 pandemic. Objective: to quantify and identify the main causes of increased disease burden due to coronavirus disease 2019, COVID-19, pandemic. Conclusion. The COVID-19 pandemic significantly increased the burden of several non-COVID conditions, particularly mental health disorders, malaria in young children in the African region, and stroke and ischemic heart disease in older adults, with notable disparities across age and sex. These findings underscore the urgent need to strengthen health system resilience, enhance integrated surveillance, and adopt syndemic-informed strategies to support equitable preparedness for future public health emergencies. Next, we will be discussing articles from Lancet. Global, regional, and national trends in routine childhood vaccination coverage from 1980 to 2023, with forecasts to 2030, a systematic analysis for the Global Burden of Disease Study 2023. Background. Since its inception in 1974, the Essential Program on Immunization (EPI) has achieved remarkable success, averting the deaths of an estimated 154 million children worldwide through routine childhood vaccination. However, more recent decades have seen persistent coverage inequities and stagnating progress, which have been further amplified by the COVID-19 pandemic. In 2019, WHO set ambitious goals for improving vaccine coverage globally through the Immunization Agenda 2030, IA 2030. Now halfway through the decade, understanding past and recent coverage trends can help inform and reorient strategies for approaching these aims in the next 5 years. Interpretation. Our estimates of current vaccine coverage and forecast to 2030 suggest that achieving IA 2030 targets, such as having zero-dose children compared with 2019 levels, and reaching 90% global coverage for life course vaccines, DTP3, PCV3, and MCV2, will require accelerated progress. Substantial increases in coverage are necessary in many countries and territories, with those in sub-Saharan Africa and South Asia facing the greatest challenges. Recent declines will need to be reversed to restore previous coverage levels in Latin America and the Caribbean, especially for DTP1, DTP3, and POL3. These findings underscore the crucial need for targeted, equitable immunization strategies. Strengthening primary healthcare systems, addressing vaccine misinformation and hesitancy, and adapting to local contexts are essential to advancing coverage. COVID-19 pandemic recovery efforts, such as WHO's Big Catch-up, as well as efforts to bolster routine services, must prioritize reaching marginalized populations and target subnational geographies to regain lost ground and achieve global immunization goals. Next, we will be discussing articles in the field of hemato-oncology. Here are the articles from JAMA Oncology. Nivolumab and ipilimumab combination treatment in advanced ovarian and endometrial clear cell cancer non-randomized clinical trial. Question: what is the efficacy of nivolumab and ipilimumab combination treatment in patients with advanced gynecological clear cell cancers? Findings: In this non-randomized clinical trial, including 28 patients with gynecological clear cell cancers, an objective response rate of 54% and a 6-month progression-free survival of 58% was observed, with all responses being ongoing, meaning nivolumab and ipilimumab combination therapy has significant activity in gynecological clear cell cancers and warrants further investigation. Next, we will be discussing articles in the field of gastroenterology. Here are the articles from Journal of Hepatology: All-Cause and Cause-Specific Mortality in Patients with Chronic Hepatitis B and Concurrent Steatotic Liver Disease. Cumulative metabolic burden dose dependently increases mortality risks in patients with CHB and concurrent SLD. New onset diabetes mellitus, hypertension, and weight gain further exacerbate the risks of mortality. Patients with concurrent SLD have a lower risk of mortality than those without SLD, regardless of metabolic dysfunctions. Routine screening and the aggressive identification of metabolic dysfunctions are crucial. Here are the articles from Gastroenterology. Capsule endoscopy guided proactive treat to target versus continued standard care in patients with quiescent Crohn's disease, a randomized controlled trial. Background and aims. Optimal treat to target strategies for Crohn's disease, CD, are still being sought. The value of video capsule endoscopy, VCE, to guide proactive treat to target optimization in CD was examined. Conclusions. A VCE-guided treat to target strategy for patients with CD in remission confers superior clinical outcomes compared with continued standard care. Here are the articles from Clinical Gastroenterology. Real-world clinical effectiveness and safety of vedolizumab and adalimumab in biologic-naive patients with Crohn's disease. Results from the EVOLVE study. Goals. This study evaluated the real-world effectiveness and safety of vedolizumab versus adalimumab over 12 months of treatment in biologic-naive patients with Crohn's disease, CD, using data from the EVOLVE study. A comparison of vedolizumab and adalimumab may help to better position them in the therapeutic algorithm for moderate to severe CD. Conclusions. In a real-world setting, biologic-naive patients with CD treated with vedolizumab demonstrated a greater likelihood of drug persistence and achieving clinical remission, with equivalent rates of response and mucosal healing versus adalimumab-treated patients. Next, we will be discussing articles in the field of cardiology. Here are the articles from Circulation. Efficacy and safety of inclisiran in adolescents with genetically confirmed homozygous familial hypercholesterolemia. Results from the double-blind, placebo-controlled part of the Orion 13 randomized trial. Background. Homozygous familial hypercholesterolemia, HoFH, is a genetic disease characterized by high levels of low-density lipoprotein cholesterol, LDLC, present from birth, leading to early onset and progressive atherosclerotic cardiovascular disease. Early treatment initiation is crucial for cardiovascular risk reduction. However, many patients do not reach LDLC treatment goals. Inclisiran, a small interfering RNA targeting hepatic PCSK9, proprotein convertase subtilisin/Cushing type 9, is effective and well tolerated in adult patients with hyperlipidemia. However, it has not yet been studied in pediatric patients. See Conclusions. In a 1-year randomized controlled study, Part 1 of Orion 13, inclisiran was effective in lowering LDL-C in adolescents with HoFH and was well tolerated. These results support inclisiran as a potentially useful addition for the treatment of adolescents with HoFH and a minimum of LDLR residual activity. Here are the articles from Journals of the American College of Cardiology. Biolimus-eluting biomatrix stent versus a dual-therapy sirolimus-eluting stent in PCI, the SORT-OUT 11 randomized trial. Background. Percutaneous coronary intervention, PCI, with new-generation drug-eluting stents, DES, is still associated with risk of target lesion failure, TLF. The Biolimus A9 eluting biomatrix alpha stent, BES, with biodegradable polymer and thin struts, has not been compared head-to-head with another contemporary DES conclusions. BES was non-inferior to DTS at 1-year follow-up regarding the primary endpoint of TLF. However, BES was associated with significantly increased risk of definite stent thrombosis. From JAMA Cardiology. OCT versus angiography for guidance of percutaneous coronary intervention of calcified lesions. The Calypso randomized clinical trial. Question: is optical coherence tomography, OCT, imaging superior to angiography when guiding percutaneous coronary intervention, PCI, procedures in calcified coronary lesions? Findings: in this randomized clinical trial, an OCT-based strategy, including lesion analysis and standardized plaque preparation according to predefined algorithms, resulted in better stent implantation results, stent expansion and apposition, than angiography guidance, without any additional safety concern. Meaning, considering the high incidence of calcified stenosis among patients with stable coronary artery disease, and the poorer prognosis of PCI in this situation, use of this OCT-based strategy could improve the clinical outcome of these patients by improving the quality of stent implantation. Next, we will be discussing articles in the field of endocrinology. Here are the articles from Journal of Clinical Endocrinology and Metabolism. The role of whole food plant-based food intake on postprandial glycemia in type 1 diabetes. Context: a whole food plant-based diet, WFPBD, minimally processed foods with limited consumption of animal products, is associated with improved health outcomes. The benefits of WFPBD are underexplored in individuals with type 1 diabetes, T1D. Objective: the primary objective of this analysis is to evaluate the association between WFPBD on glycemia in individuals with T1D. Conclusion: meal events with higher EPD were associated with 4% postprandial tear improvement. These benefits were seen primarily in WFPBD meals, captured by APDI, and less pronounced plant-based meals, captured by PDI, emphasizing the benefit of increasing unprocessed food intake over limiting animal products. Here are the articles from Diabetes Care. Associations of concurrent hypertension and type 2 diabetes with mortality outcomes, a prospective study of U.S. adults. Objective: to investigate associations of concurrent hypertension and type 2 diabetes, T2D, with mortality in U.S. adults and elucidate differences by sex, race, and ethnicity to inclusions. Concurrent hypertension and T2D predict high mortality risk, underscoring the critical need for contextual interventions that extend health span in the U.S. Next, we will be discussing articles in the field of pulmonary and critical care. Here are the articles from CHEST. Clinical remission over 2 years with benralizumab in severe eosinophilic asthma. Background: long-term real-world data on clinical remission in patients with severe eosinophilic asthma, SEA, receiving biologics are lacking. We describe clinical remission over 2 years in patients with C receiving benralizumab. Research question: is long-term clinical remission a viable goal for patients with C receiving benralizumab? Interpretation: our results indicate that clinical remission is a realistic goal, sustainable up to 2 years in around 1/3 of patients with C receiving benralizumab. In this study, remission was more likely in patients with lower baseline disease burden, suggesting that further research is warranted regarding whether earlier initiation of a biologic may be beneficial. Here are the articles from the American Journal of Respiratory and Critical Care Medicine. Deep learning estimation of small airway disease from inspiratory chest computed tomography, clinical validation, repeatability, and associations with adverse clinical outcomes in chronic obstructive pulmonary disease. Rationale: quantifying functional small airway disease, FCID, requires additional expiratory computed tomography, CT, scans, limiting clinical applicability. Artificial intelligence, AI, could enable Efsitora quantification from chest CT scans at total lung capacity, TLC, alone, Efsitora. Objectives: to evaluate an AI model for estimating FSAD-TT, compare it with dual-volume parametric response mapping FCIT, FSAD-PREM, and assess its clinical associations and repeatability in chronic obstructive pulmonary disease, COPD. Conclusions: small airway disease can be reliably assessed from a single inspiratory CT scan using generative AI, eliminating the need for an additional expiratory CT scan. FCID estimation from inspiratory CT correlates strongly with FCID-PREM, demonstrates a significant association with F1 decline, and offers greater repeatability. Next, we will be discussing articles in the field of nephrology. Here are the articles from Clinical Journal of American Society of Nephrology. Unveiling the causal relationship between thyroid and kidney function, a multivariable Mendelian randomization. Key points: thyroid-stimulating hormone levels were inversely associated with eGFR, and hypothyroidism was correlated with lower eGFR levels. Multivariable Mendelian randomization analysis confirms a causal link between elevated thyroid-stimulating hormone levels and reduced EGFR in diverse populations. Findings highlight the importance of considering thyroid dysfunction in CKD management and targeted treatments. Here are the articles from Kidney International Reports. Characterization of monogenic kidney disease in older patients with CKD. Introduction. Although 10% of adults with chronic kidney disease, CKD, have a monogenic cause, the characteristics of monogenic CKD in older adults, aged greater than or equal to 60 years, are less characterized. We aimed to assess the clinical and genetic spectrum of older adults with CKD and the clinical utility of genetic findings. Conclusion. In older patients with CKD, genetic testing revealed enriched variants associated with less penetrant phenotypes, often with a family history of CKD, which affects clinical management.
Thank you for listening to This Week in Medicine, your filtered medical journal summary. Have a great week ahead, stay blessed and be humane.